everyone. Welcome to our Community Health Podcast. My name is Colleen.
Hi, I'm Lisa.
Hi, I'm Sabrina.
And I'm August.
So today we'll be discussing our community development project, the Downtown Oshawa Integrated Food Security and Health Empowerment Project, or as we like to call it, the IFSHE project. Our project focuses on improving food security among individuals experiencing homelessness in downtown Oshawa through community-based mobile food and health outreach program.
Our project began with a comprehensive community assessment. We identified people experiencing homelessness in downtown Oshawa as a vulnerable population facing significant health inequities. While many people think homelessness is simply about not having housing, it's actually much more complex. Individuals experiencing homelessness often struggle with food insecurity, chronic illness, mental health challenges, substance use disorders, and barriers to healthcare.
One of our most important findings was that although Oshawa has food banks, shelters, outreach programs, many people still struggle to access nutritious meals. Transportation barriers, limited service hours, stigma, and previous negative experiences with healthcare systems often prevent people from seeking help.
We also learned that food insecurity is directly connected to several social determinants of health. Poverty, unemployment, housing instability, discrimination, and limited access to healthcare all interact to create ongoing health inequities. This showed us that simply handing out food would not be enough. We needed a solution that addressed both immediate needs and underlying causes.
So using those findings, we developed the IFSHE project. The overall goal is to improve access to nutritious food and integrated health for individuals experiencing homelessness while building stronger community partnerships.
The project is guided by the socio-ecological model, which recognizes that health is influenced by multiple levels. At the individual level, we provide nutritious meals and health assessments. The interpersonal level, peer support navigators help build trusting relationships. At the community level, the mobile outreach unit brings services directly to where people are. Organizational partnerships improve coordination among agencies, and advocacy efforts address broader societal issues like poverty and affordable housing.
To organize our project, we used a logic model. The inputs include community health nurses, peer support navigators, volunteers, funding, food donations, and community partnerships. These resources support activities such as mobile meal distribution, health screening, health education referrals, and coalition meetings. Those activities lead to measurable outputs, including thousands of meals distributed, health assessments completed, and referrals made to healthcare and housing services.
Implementation will occur over a 12-month period using a mobile outreach vehicle operating 6 days each week throughout downtown Oshawa.
So the mobile unit will provide much more than food. Community health nurses will offer wound care, blood pressure checks, blood glucose monitoring, vaccinations, health education, and referrals to healthcare providers and community resources.
One unique aspect of our project is the inclusion of peer support navigators. These are individuals with lived experience of homelessness who work alongside nurses. Because they understand many of the challenges participants face, they help build trust and reduce barriers to care.
Community engagement is another key component. Rather than making decisions for the community, we'll actively involve participants through advisory committees and regular feedback sessions. Their voices will guide meal planning, outreach schedules, and future improvements to the program.
We also recognize there will be challenges. Funding limitations, severe weather, changing encampment locations, and staff burnout are all realistic barriers. To address these challenges, we'll establish diverse funding sources, strong community partnerships, flexible outreach schedules, and staff wellness supports.
Evaluation is essential because it tells us whether the project is actually making a difference.
We'll evaluate both the implementation process and the outcomes. Process evaluation looks at whether the project is operating as planned. For example, we'll measure how many outreach visits were completed, how many meals were distributed, and how many health assessments were performed.
Outcome evaluation focuses on whether participants experience meaningful improvements. We'll collect surveys, interviews, attendance records, referral data, and participant feedback to determine whether food security has improved, whether people are accessing healthcare services, and whether participants feel more connected to their community supports.
The findings won't just stay within our project. We'll share the results with Durham Region Public Health, community partners, funders, and municipal leaders. Those findings can help improve future programs and support policy changes that address homelessness and food insecurity throughout the Durham region.
Throughout this project, community health nurses play an essential leadership role. Nurses are responsible for health promotion, disease prevention, advocacy, community engagement, and coordinating care across multiple organizations.
This project demonstrates that community health nursing extends far beyond hospitals and clinics. Nurses meet people where they are, reduce barriers to care, advocate for vulnerable populations, and work collaboratively to improve population health.
By addressing both immediate needs and the broader social determinants of health, nurses help create sustainable change that benefits individuals and entire communities.
In conclusion, the If She project demonstrates how a collaborative, community-based approach can improve food security while strengthening access to healthcare for individuals experiencing homelessness.
By combining mobile food outreach, nursing care, peer support, community partnerships, and patient policy advocacy, the project addresses both the immediate effects and the underlying causes of food insecurity.
Our proposal highlights the importance of health equity, community engagement, and interdisciplinary collaboration in promoting healthier communities.
Thank you very much for listening to our discussion about the Downtown Oshawa Integrated Food Security and Health Empowerment Project. We hope this conversation has demonstrated how community health nursing can create meaningful and lasting change for vulnerable populations.
Thank you
for listening. Thanks for listening.